Hello everyone. So today we are going to discuss the anatomy of heart. Heart is a hollow cone-shaped muscular organ. The heart beats about 2.5 billion times in an average lifetime. It is a small organ. It is about 12 cm in length, 9 cm in width and 6 cm in thick. The weight of the heart is vary for man and woman. In man, the weight of the heart is around about 310 gram. In women, it's around 225 gram. Let's see the position of the heart. Heart lies in the thoracic cavity in the mediastinum, the space between the lungs. It lies obliquely a little more to the left than the right and present a base above and apex below. The position of the heart is it's affect the lobe of the lung because the reason of the position of the heart, left lung has divided only 2 lobes and right lung has divided in 3 lobes. The apex is about 9 cm to the left of the midline at the level of intercostal space, that is a little below the nipple and slightly nearer to the midline. The base extends the level of second rib. Let's see the chamber of our heart. The heart has 4 chambers: right atrium, right ventricle, left atrium, left ventricle. So the right side of our chamber, they receive the deoxygenated blood, and the left side of our heart, they receive the oxygenated blood. Let's see the valve of the heart. Our heart has 4 valves: 2 atrioventricular valves, 2 semilunar valves. Under the atrioventricular valves, we have tricuspid valve and mitral valve. The valves actually they separate the chamber. The first tricuspid valve separate the right atrium and right ventricle. Next is mitral valve, which is also called bicuspid valve. It separates the left atrium and left ventricles. Next come to the semilunar valves, that is aortic valve, that is separate the left ventricle from aorta. Next, pulmonic valve, that separate right ventricle from the pulmonary artery. Okay, let's see the layer of heart. Before starting the layer, let's see the covering of our heart. The pericardium, which is also called pericardial cell, a double wall cell. It has 2 layers, a serous and a fibrous layer. A serous is also called visceral layer, then fibrous, which is also called parietal layer. And in between the serous and fibrous layer, there is a space that is called pericardial space. In that space is filled with the one type of fluid that is called pericardial fluid, and this pericardial fluid which is help to prevent the friction. And let's come to the layer of heart. Our heart has 3 layers: epicardium, myocardium, endocardium. The epicardium is the external layer, myocardium is the middle layer, and endocardium is the inner layer. So this myocardium actually is made with the muscle, and because of this myocardium our heart can contract properly. Okay, and in endocardium, which is the inner layer, all the valves and valves are located under the inside the endocardium layer. Next come to the muscle of the heart. The heart has specific muscle. We know that the types of muscle, that is cardiac muscle, which are only located in the heart. These cardiac muscles, because of this cardiac muscle, heart can contract and open and close the heart valves. The sum of these muscles are trabeculae, corni and chordae tendineae. Next come to the arterial supply of the heart. So arterial supply like it is provided by the right and left artery, coronary artery. And blood flow inside the heart, if we see that let's see like our superior and inferior vena cava, they collect the deoxygenated blood from the body and they empty in the right atrium. So right atrium, they empty their chamber in the right ventricle through right ventricle through tricuspid valve, and right ventricle will empty their chamber through pulmonary valve and they send it to the pulmonary artery. Pulmonary artery will carry the deoxygenated blood and they will send it to the lungs for purifying. So after purifying, that oxygenated blood will carry by the pulmonary vein and they will send it to the left atrium. Left atrium, they will empty their chamber to the left ventricle through mitral valve, and left ventricle will send it that oxygenated blood to the aorta through aortic valve, and aorta will carry that oxygenated blood and they will send it to the rest of the body. In that way, the whole body will get the oxygenated blood. Thank you.